Dr. William Davis here, author of the Wheat Belly and Undoctored books. Well, eggs are in the headlines again because there was a recent study that suggested that egg consumption increased heart attacks and death. So 30,000 people answered a questionnaire and were followed for several years, and people who consumed more eggs and thereby dietary cholesterol had 17% more cardiovascular events and 18% higher mortality, death. And the researchers who did the study said, this is reason to cut back on eggs and reintroduce the cholesterol limitation into the dietary guidelines, because they were removed recently because the overwhelming evidence suggests that dietary cholesterol has nothing to do with heart disease and does not have any major effect on blood cholesterol levels. Well, what's wrong with all this? Well, this study is an example of what's called an observational study, which is about as good as no study at all. It's garbage science. We have lots of observational studies, and these are the studies that have been responsible for all the confusing headlines you hear. Red meat causes cancer. Red meat's okay. Eggs cause heart disease. Eggs are okay. All that confusing stuff is because of the observational studies. To illustrate just how far off course you can go with observational studies, my favorite example is Premarin, the drug Premarin. Premarin is horse estrogen. It's recovered from pregnant mares, the urine of pregnant mares. Well, based on observational studies, Premarin was the most widely prescribed drug to women for about a decade. A huge amount of this drug was sold to women based on evidence that suggested that women who took Premarin had less endometrial cancer, had less breast cancer, had less cardiovascular events and death. Because what they did, they asked women, Jane, do you take Premarin? Yes, I do. Martha, do you take Premarin? No, I don't. And those two groups of people like that would be followed. And the women who took Premarin appeared to have fewer cardiovascular events and cancers. Well, then the real clinical study was performed, where I say, Jane, take this pill. I don't know what it is. You won't know what it is. We'll tell you in 5 years when the study's over. So thousands of women participated in these studies, the HERS trial and the Women's Health Initiative trial, prospective randomized studies where the participants did not know what they were taking. In these studies, the real studies, there was an increased risk of endometrial cancer, increased breast cancer, increased cardiovascular events and death, and acceleration of dementia. In other words, the real data showed the exact opposite of the observational data. This is true over and over and over again, so much so that 80% of conclusions drawn in observational studies are eventually disproven. So it's like a roll of the dice, whether this is true or not. So my advice to you is do not listen to these silly studies. Now, unfortunately, you'd have to read the study to tell whether it's observational or not, or stay tuned to these kinds of conversations like I'm providing right now. And one of the reasons why observational studies are so unreliable is because there's several reasons, but one main reason is called confounding factors. That is, people who eat eggs versus people who don't eat eggs can be two different kinds of people. Maybe the ones who eat eggs eat a lot of cured bacon that has sodium nitrite that reacts when heated with the proteins in meat. It causes nitrosamines that are carcinogens. In other words, there's a whole bunch of other factors. For the same reason, for instance, people often say that vegetarians are healthier than non-vegetarian, than omnivores. Well, that may be true, but it's not because of the lack of animal products. It's because of the confounding factors, such as people who are vegetarian tend not to smoke, tend to drink less, tend to exercise, tend to be more health conscious. But it doesn't necessarily mean that absence of animal products per se is the cause. And so watch out when you have headlines that have relied on observational data. Observational data, I often say, is as good as no data at all. So don't be concerned about eggs. Eggs are fine. Dietary cholesterol has no impact on your health. If you follow the wheat belly and undoctored lifestyle, you follow a high-fat lifestyle absent all grains and sugars.